Hello everybody, my name is Abby Lawton and this is my needs assessment survey presentation. So this is going to be the outline for my needs assessment presentation. We're first going to discuss what the need is. Then we will go into the importance of proper training, as that is what the need is centered around. We will then discuss the data that was found in the needs assessment survey, and then we will go over what we can do with the information that we did find. So starting off with the need in a need assessment survey is essentially the difference between the current state and the state that we want to get to. My survey was done regarding a new CT scanner that we had installed at my facility. We got it about 3 to 4 months ago, and the interface of the scanner is completely different from what we're used to using. We received what I would say is very minimal training on the scanner, so I decided to focus my survey around the comfort that my fellow techs have, as well as their proficiency in the scanner. The need assessment can be done either to assume that the techs are being trained properly, which then you will be able to back up with your survey results, or it's going to determine their competency levels and potentially a need for additional training. So why is proper training important? First off, a trained tech is a happy tech. Studies have showed that staff who are well trained are happier on the job, and then that leads to them having respect from their peers, from administration, the staff physicians, as well as patients, as all of these parties will be able to tell that the tech knows what they're doing and they're very competent and educated. A higher productivity level also leads to lower turnover. Employees that receive necessary training lead to companies that are 17% more productive, and they are also 45% more likely to stay in their role, which, as we know in healthcare, we have a huge shortage of techs, nurses, doctors, so it's very important to try to hold on to the employees that you do have. And lower turnover will lead to healthier patients. A high staff turnover in the healthcare setting has been shown to have an effect on patient health, the length that patients are hospitalized, as well as the quality of their care. So here is some of the data that was collected from the survey. The techs were first asked to rate their proficiency out of 100, how they feel regarding the current interface that we use. The average proficiency was rated an 88.92, which is fairly high. And then they were asked to rate their proficiency using the new interface, and that received an average of 65.75. So pretty big gap, pretty low proficiency regarding the new scanner. They were then asked to rate their ability to teach another technologist how to use the new scanner, assuming that that technologist had no experience with this interface, which received an average of 60.55 out of 100. So again, pretty low proficiency rating. Techs were then asked a series of questions regarding their comfort doing different tasks on this new scanner, and retrospective reconstruction was rated number 1 as the task that techs felt the least comfortable doing. As we know in CT, retrospective reconstruction is very important in terms of getting exams done faster, getting results faster, and saving patients' radiation dose. Lastly, 75% of the respondents said that they feel that they did not receive adequate training when it came to this new interface. So now that we have our results, what are we going to do with them? Well, first what we can do is we can kind of hone in on what the techs don't know or don't feel super comfortable with and do a secondary training session. This will be a lot more focused and a lot more in tune to what they don't know rather than just a generalized training session. That way it is more effective, more efficient, and it'll help us get everyone back up to speed. Then we can always do a secondary reassessment. This will just be another survey that we can do to compare to the results of this one to see if there's any improvement, make sure that everyone is feeling more comfortable and more knowledgeable in terms of using the scanner. And that concludes my needs assessment survey presentation. Thank you.